The sitting is resumed. Members, it's time for questions to the Minister of Health. Questions 5, 8 and 11 have been withdrawn. Sinead Bradley is not on her place, so I call Padraig Delargy.
Can I ask the Minister for Health for an update on the HSE staff recognition payment for those working in the independent sector?
Sorry, you just need to put the number.
Sorry. Question 3.
And I thank the member for his question. Mr Speaker, members will be aware that earlier this year I announced a special recognition payment of £500, and that will be made to Northern Ireland's health and social care workers. Payments to the statutory sector employees commenced in July, but unlike the statutory sector payments whereby my officials were working with a small number of employers, the independent sector has a much larger employer base. In addition, workers within the independent sector are much more transient than the statutory sector, and developing a set of standardised eligibility criteria has proven to be more challenging than first initiated and thought. Likewise, the development of a payment mechanism, particularly in circumstances where an employee has moved between providers or has moved out of the sector completely, has proven problematic. I met again with my officials last week to get a full update on the latest progress and to emphasise the need to see the payments processed as quickly as possible. Officials have in recent days had further detailed discussions with trusts, the Health and Social Care Board and BSO in relation to the delivery and accountability mechanisms of the recognition payment to the independent sector, and I am glad to report that work has now almost completed. My officials have also held recent discussions with a number of major care home and domiciliary providers and the voluntary sector providers to ensure that the proposed delivery mechanisms are workable, deliverable, accountable and auditable. The engagement with the sectors has been very positive, and we will continue to work closely with all involved. The recognition payments will be paid to the independent sector staff as soon as possible.
Supplementary, Padraig Delargy.
Yeah, Minister, thanks for that. And you've pretty much answered my supplementary already, but I did want to make sure that all agencies had been contacted. I've been contacted by quite a few people in my constituency who weren't sure who contact hadn't been made with, so could you just confirm if all agencies have been contacted at this point, please?
And I thank the member for his point. In regards to the sections that are left, we have been engaged with Community Pharmacy, the British Dental Association, Optometry A&I, British Medical Association, a number of the major care home and domiciliary care providers at this moment in time. We have a small pilot out in regards to the documentation that we intend to use, and we hope to have feedback from those initial sectors and those initial groups that we've engaged with by the end of this week to make sure that the documentation is workable for them, but also provides us with the information that we need as well.
Call Colin McGrath.
Mr Speaker. Mr Speaker, I appreciate that absolutely everything has to be done correctly and by the book, but this announcement was made back in January. Staff are contacting MLAs almost on a weekly basis because they've been promised this £500, and we today don't even have a date as to when this is going to happen. Can the Minister please give us some indication of when this payment is going to be made? Because I know that many of my constituency were hoping to have it for Christmas.
As I've already said in the initial answer, it has proven more challenging, especially for the independent sector, than we initially thought because of the large number of employers. But we need to make sure, I think as the members indicated, that we will have to be sure that this is public money and it is spent as accountable and it is audible as well. It is taking longer in this section than this sector of the employee and the workforce than we had initially anticipated. But I will say in the first tranche, and I know when we announced this payment there was also additional requests then made and subsequent requests made to make sure it wasn't taxable. So we went back to ask for more money as well. That was provided by the executive. There was also a number of requests and checks made by trade unions and other organisations that any payment made would not have a knock-on effect on to benefit payments in regards to what is especially a low-paid female workforce as well. So all that took time even before we got the initial payments out to the health and social care sector, which was a very small employer base that we were able to work with. We're pushing on as hard as we can to get this payment out as soon as possible. And I know the members, a number of AQs, want to reassure him that the money is there for it. It's not a case of that this has been delayed deliberately in any space. We want this money out as well.
Well, Mike Nesbitt.
The Minister confirmed that his officials with responsibility for other recipients of the payment including primary care, pharmacy, dental and ophthalmology, are fully linked in and working to deliver the payment ASAP.
And I thank the member for the point. I think, in response to the initial question I made, that we are engaging, and we have engaged. I met with officials again last week to make sure that they were fully plugged into everything that needed to be done to make sure this payment gets out there. And as I said, in a previous statement there, that this payment is taxable. So we need to make sure also that anybody who receives, any employer that receives this money, is making sure that the majority of it, if not all of it, in regards to how it actually gets to those it is meant to be for, and it doesn't stay in the employer's bank account for any time or any period longer than it actually has to.
Paula Bradshaw.
Minister, can you confirm whether those working in independent hospitals who were commissioned to deliver, for example, diagnostic or elective care surgery, whether they will be eligible? Thank you.
I thank the member, and I think that's covered in our FAQ on the special recognition payment, which includes eligibility criteria. As set out in that FAQ that is online, those who meet the qualifying criteria are eligible for the payment. In this case, at least 1 month's continual service in the independent sector in Northern Ireland between the 17th of March and the 31st of January is required. Former independent sector NI staff who retired between that period are eligible, providing they meet the qualifying criteria. In regards to the specific work group that the member's inquiring about, we have to make sure that those individuals who are also working in that sector are not also trust employees as well, so that it's only a single payment they receive. But I'll get clarity for the member on that cohort.
Ermer Passing McGlone, call Passing McGlone.
Good evening, I can call you Cash Ever 3, question number 3.
And I thank the member. Trusts have developed and implemented dementia services recovery plans, which have ensured continued access to a range of services during the COVID-19 pandemic, using technology and other innovative approaches to ensure arrangements are in place to access diagnostic, condition management and support services to both service users and carers. As a direct result of the COVID-19 pandemic and the increased vulnerability of many within that patient cohort, there has been a reduction in the numbers of patients facing memory clinics, which has had a direct adverse impact on waiting time. Virtual clinics have been trialled for a subset of individuals, and this option is being kept under review. The rollout of the regional dementia care pathway will contribute significantly to raising standards across all trusts, and that includes addressing delays in dementia diagnosis. A regional steering group has been established to have the oversight of implementation across all 5 trust areas and to ensure there is a consistency of approach and shared learning. That work is supported by a regional stakeholder reference group and an integrated care partnership led locally implementation groups, which are multi-agency and also include people living with dementia and their carers. The expectation is that the pathway will be rolled out across all areas, subject to the availability of the necessary funding, which the member will be aware will be significant.
Supplementary, Passing McGlone.
I thank the Minister for his answer. Just referring to a previous response that the Minister made in reply to an AQW from my colleague, Cara Hunter, it showed there's great disparity in waiting times between trust areas. What can his department do to rectify those big disparities between various trusts?
And I thank the member for that point, and that's why I was specifically referenced the dementia care pathway, which is about making sure there is that continuity across all trust areas. That includes a regional steering group as well, so that we can bring members from all trusts into the one place, so they can learn from each other to ensure that there is that consistency approach. That work, as I said, is also being supported by a regional stakeholder reference group, which includes those with dementia, their carers and those with lived experience. So it's something that we've been able to utilise during the pandemic, but we've also seen how that can ensure there will be a consistency of approach across Northern Ireland, which, as the member is well aware, is geographically a very small footprint when it comes to these levels of services.
Call Sinead Ennis.
Dementia is an awful, cruel illness, as we all know, and as the Minister's outlined, there are measures to help, and the regional dementia care pathway is one, but so is supporting those with dementia who are in the community. So I just want to ask the Minister, what can your department do to support dementia-friendly communities?
And I thank the member, and as she will know, the Regional Dementia Strategy, which was actually developed as far back in 2011, addressed a wide range of issues, and that drew on best practice here and elsewhere. That strategy made recommendations aimed at improving the services and support arrangements. To date, we've implemented a significant number of programmes to improve services provided to and the experience of those living with dementia. In 2016, the Delivering Social Change Dementia Programme Phase 1, Still Me, was launched. That programme included a package of dementia projects, and at that point there was funding of £6.25 million. My department has also previously provided funding to support the rollout of actions from the Delivering Social Change Dementia Programme. That's included 10 dementia service improvement leads, 10 dementia navigators and 44 dementia companions. So there has been work already been done in the community, and that's part of the reform of the adult social care system, that new strategy that will bring forward as well.
Call George Robinson.
Mr. Speaker.
I thank the member for his question. The JCVI has advised that the groups 1 to 9 prioritised in Phase 1 of the COVID-19 vaccination programme should be offered a booster dose of the COVID-19 vaccine. JCVI advice states that the COVID-19 booster vaccine dose should be offered no earlier than 6 months after completion of the primary vaccine courses, and that's the full 2 doses. The 6-month interval between completing the primary course and the booster dose will drive the timeline actually for eligibility and delivery. The various health and social care trusts began booster vaccination programmes in care homes in the week commencing the 20th of September, and trusts have also begun further vaccination of frontline health and social care staff in line with JCVI guidance. As of midday today, 29,836 booster doses have been delivered, as well as 4,123 third doses. GPs will shortly begin calling their patients who received their second dose 6 or more months ago, with 220 community pharmacies across Northern Ireland starting the booster programme with frontline healthcare staff who are not directly employed by a trust. And it is hoped that the majority of eligible people will have received their booster by the end of this year.
George Robinson, supplementary.
Thank the Minister for his answers. Can the Minister give me an assurance that there will be a sufficient supply of booster vaccines available, as concerns have been expressed to me by health professionals and constituents in my area that there may be a shortfall?
I can assure the member there is no shortfall of booster doses vaccines that will be available. The criteria that we currently work for may seem more stringent than we first used, because we're going back to those first 9 priority groups rather than the mass vaccination programmes we've seen. But we're also working on the 6-month timeline, so when we were seeing those small numbers coming forward in the initial vaccine programme, it is now they that are eligible for the third dose as well. So I can give the member that assurance that we haven't concerns in regards to supply of vaccines for booster doses.
Well, Kelly Armstrong.
Thank you, Mr. Speaker. Thank you, Minister. Minister, can you confirm when 16 and 17-year-olds will be offered a second dose, given this is clearly recommended for the Delta variant, and parents are telling me that they cannot access COVID certificates without a second dose?
I thank the member. 16s and 17-year-olds, as the member is aware, has been offered the first dose, and I would encourage all those who are eligible to come forward at this minute in time. With 50% of those who are eligible and actually have come forward and received their first dose. JCVI are currently monitoring the implementation of a second dose, and once we receive that guidance from them, whether it's necessary to proceed and when it's necessary to proceed, we will do so. There should be no delay or challenge in regards to that age group if they've received 1 dose and actually accessing proof of vaccination as well, but I'll clarify that with the member too. What I will say as well in regards to that certification, many countries don't require it for under 18s, so it may be worth checking as well whether that's actually necessary at this minute in time.
Call Aisling Riley.
Minister, considering that the flu and the COVID-19 vaccination programmes are happening at the same time, can you provide assurance that staffing requirements for these programmes won't take away from the delivery of the already heavily under pressure GP services?
And again, I thank the member for raising what is a very critical point, and I welcome her to her place. I will say what we actually experienced last year, Mr Speaker, in regards to the rollout of the flu vaccine programme, we saw a massive uptake as actually how GPs delivered it. We've seen it actually over the weekend, where GPs have taken over, multi-storey car parks, and they're delivering up to 1,200 flu vaccines in one day in one sitting as well. So we've seen a change in how that has been approached. That we're actually seeing those mass vaccination programmes rolling out at GP level as well. I would have liked to have been in a place where we were delivering flu and COVID booster at the same time concurrently, and we could have made use of that efficiency as well. But we're not in the place, as regards to, in the answer to Mr Robson, we're not in the place where we have those same large numbers coming forward for the booster dose. So we've went ahead and started the flu vaccine programme because we are aware of the benefit that comes from that. And again, I would encourage anyone who's not just eligible for the COVID booster to come forward and get it, or the first dose or their second dose, but also anyone who is now eligible for the flu vaccine to make sure they come forward and get it as well, because those criteria have also been expanded as well.
Alan Chambers.
I welcome the continued and very important role that community pharmacy is playing in the booster programme. Is the Minister satisfied that with so many community pharmacies engaged, over 200 I believe, that the booster still remains a very accessible service right across Northern Ireland?
And I thank the member for that very specific point. And I think, as I said in the initial answer, over 220 community pharmacies have come forward in regards to being able to supply and deliver the COVID booster programme, which is about half the community pharmacies across Northern Ireland. So that ineligible leaves it very accessible for the majority of people in Northern Ireland actually to go to their local community pharmacy and receive that booster dose. And what I will say to the member as well, over the past 18 months, we've seen a real partnership approach in the working of not just the department and community pharmacy, but also community pharmacy linking in with primary and secondary care and supporting what has been a very challenging time across the entirety of our health family. So again, I want to place on record my thanks to community pharmacy for delivering what is the next phase of our vaccination programme, and that is the delivery of the booster vaccine, but also them delivering the flu vaccination as well.
Palm Cameron.
I thank the Minister for his answers so far. Minister, could you maybe update us on where the schools vaccination rollout programme is at the moment for the over 12s?
I thank the member for that point as well. Our school programme should be commencing within the next number of weeks. We already have commenced actually vaccinating in the special schools as well, because of the criteria that was laid out by JCVI in regards to those eligible cohorts as well, and those more vulnerable cohorts. So that piece of work is ongoing and will commence. And as previously advised, those eligible cohorts and the eligible group to 12 to 15-year-old are able to receive their vaccines because of the expanded advice that was actually given from JCVI, which was supplemented then further by the advice that we received from all 4 CMOs. So, as previously advised, persons aged 12 to 15 with specific underlying health conditions that have put them at risk have been offered 2 doses of the Pfizer BNT162b2 vaccine, and the original group included children with severe, as the member was aware, neurodisabilities, Down syndromes and underlying conditions. That age cohort has already started to be vaccinated, but our main school programme will be commencing within the next week as well, using our school vaccination teams. And I would encourage parents who have children eligible in that age group to make sure they get their children brought forward to complete the appropriate documentation and get their children vaccinated as regarded to CMO and JCVI guidance.
Sinead Annis.
I thank the member for her questions. There is clear evidence that our unscheduled care system has been under increasing pressure over the past number of years. These pressures are most clearly seen at our emergency departments, which act as a bottleneck for all patients who are unable to access the care they require. The significant challenges facing our elective care, cancer and mental health services are increasingly leading to patients presenting at emergency departments as their conditions worsen, and that leads to the need for urgent care. Many patients are also presenting with more advanced or complex needs, particularly those with chronic disease. And the impact of the pandemic, together with the wider systemic pressures that we are facing, has led to a situation where each of the major emergency departments across Northern Ireland are now operating significantly above capacity. The Health and Social Care Board is currently working collaboratively with the Public Health Agency, Northern Ireland Ambulance Service and the 5 provider trusts to improve waiting times at our emergency departments. That's by enhancing flows through the system and to facilitate timely discharge. An audit of our emergency departments' patients' pathways will be conducted to better understand and address issues for patients. My department has undertaken a review of urgent and emergency care. That will be published shortly and will be taken forward in an elective care framework and is investing in what has already been done in the No More Silos action plan. So the expansion of evidence-based ambulatory emergency care and rapid access services will also help to mitigate some of the pressures on urgent and emergency care created by long elective care waiting times. Each of these initiatives will help to reduce waiting times by improving hospital capacity and flow and developing services that enable patients to be discharged once medically fit. However, I would reiterate that the issues that we are currently seeing in our emergency departments cannot be resolved by one-off non-recurrent funding. What is needed is recurrent investment over a number of years to bring forward meaningful change.
Supplementary, Sinead Ennis.
And I thank the Minister for that response. Minister, in recent months we've heard shocking accounts of lengthy waits and lack of seating and other resources in various emergency departments, and clearly people waiting lengthy periods to be seen need at the very least to have somewhere to sit, and they need to have access to refreshment. So can I ask the Minister, what steps has the department taken to ensure that those waiting lengthy times to be seen in emergency departments don't have to sit on the floor?
And I thank the member for that point. Our patients waiting shouldn't have to sit on the floor. It would be unacceptable for them to do that. But we have the challenges as well, where our waiting rooms in our emergency departments are also still maintaining social distancing measures, as is the same footprint across all our health and social care facilities. So it does put additional strains on the footprint that they're actually using. I am aware a number of our hospitals where we have our main emergency departments have increased that waiting area by the utilisation of additional facilities, and I'm thinking of Altnagelvin in particular in regards to the additional working capacity that was actually put in place there to make sure that that didn't happen.
Call Thomas Buchanan.
Mr Speaker, Minister, I've listened to a number of initiatives that's going forward on this particular issue, but is the department doing any work with our GP surgeries in order to try and get them opened up so that we can get face-to-face appointments again with our GPs? Because a number of constituents who are in contact with our office can't get a face-to-face appointment, and therefore they're going to the A&E to be seen there. And I think that would help to free up the A&E departments if we could get the GPs opened up again.
The member for that point, it's important that people can access GP services when they need to do so. GP practices are open and will continue to provide both face-to-face appointments and alternative consultation options for patients as appropriate. Even prior to the COVID pandemic, primary care services were coming under increasing pressure. For the week of the 8th of October, the average number of patients actually presenting to primary care were 99 in regards to 1,000 of the population. So nearly 1 in every 100 of the population in Northern Ireland was presenting to a GP to be seen or to be triaged as well. So there is considerable work being done within our GP practices. General practice telephone first consultations as well, and that allows patients to seek timely medical advice from their GP, and it's the GP who decides how best to meet the need of the patient. Where a face-to-face appointment is appropriate, that will be arranged. The member will also be aware that I've invested recently or announced the investment of £5.5 million in regards to our GPs to support them over what will be a challenging number of months, because as we've seen, as I said earlier, in regards to community pharmacy, we've also seen a greater collaboration working between primary and secondary care, and I think something we should build on and work to actually deliver that one system health approach in Northern Ireland that actually serves all our patients.
Call Roy Beggs.
Mr Speaker, it's also important that there is an effective GP out of hours service to prevent people presenting at the accident and emergency centres. So can the Minister provide an update on the efforts to stabilise our GP out-of-hours service?
And again, I thank the member for the point, because I think it also highlights that it is one health service trying to support all patients, no matter where they present or how they present. And I'm aware of the continuing pressures faced by GP out-of-hours service across Northern Ireland, and that's with the demand and the increase in difficulties actually filling GP shifts. An effective out-of-hours service is a priority for me and my department, and we continue to work closely with the Health and Social Care Board on the out-of-hours providers to address the current challenges. Service improvements continue to be introduced. That includes adjusting the skill mix of clinicians, increasing levels of nurse triage provision, employing more nurse practitioners, paramedics and pharmacists, and increasing the flexibility in shift times. My departments also continue to work closely with the Health and Social Care Board on out-of-hours providers and key stakeholders to address the current challenges in out-of-hours services across Northern Ireland, and to redesign out-of-hours services, and that is aligned with No More Silos, which was the project taken forward as to how we actually improve and start to fix our emergency departments and how people present to them and where they present. And that aim is to have a more stable, sustainable and integrated service that will better meet the needs of the population, and that includes consideration of a regional model for delivery of the service as well.
Well, Mark Durgan.
Despite the recent investment in Altnagelvin that the Minister referred to in the earlier answer, the emergency department there still isn't fit for purpose in this day and age. There isn't sufficient space to deal with the volume of patients, nor an adequate layout to deal with the vulnerability of patients, and it's making life even more difficult for the great staff team there. Is the Minister aware of any further plans that the department has to invest more in Altnagelvin Emergency Department?
The member will be well aware of the financial pressures on my department, not just in single-year resource budgeting, but also in the capital improvement that we need to do. We've been underinvested, not only in that resource side, but also the capital side for more than the last 10 years. So there's a lot of work that needs to be done across our footprint. I think it's valued at £1.2 billion. The last time I looked, with 600 million worth of essential maintenance currently outstanding, and that's before we get to some of the critical investment in our capital footprint that we need to do. So the steps that we took in increasing the waiting area at Altnagelvin more than a year ago now was necessary at that point. So there's a continuing brief in regards to, and continuing watching brief in regards to what can be done with the resource that we provided to make sure that we are delivering for patients. But we do need a longer term investment, and not just our workforce but also our capital structures as well.
Call Matthew O'Toole, and the member may not get a supplementary.
Question 7, Mr Speaker.
I thank the member for his question, and I recognise that the subject of continuing health care continues to attract significant public interest both in Northern Ireland and in other jurisdictions. As members will be aware, the policy of continuing health care was updated as of February this year, with the aim of creating a fairer system where all individuals needing to avail of residential or nursing home care services will be subject to the same charging policy. This followed a public consultation which was undertaken in 2017. The new policy of a single eligibility criteria question is the same criteria as has been adopted in Scotland, a clear benchmark by which to assess if someone's principal needs can be met outside of a hospital setting, whether that be for social care or health care. In regard to the provision of continuing health care assessments, Circular Care Management Provision of Services and Charging Guidance was introduced on the 11th of March 2010. This outlined the responsibility of health and social care trusts to ensure that appropriate assessments of needs for individuals are carried out, and that includes those with continuing health care needs. In light of the new policy, it remains the responsibility of trusts, as outlined in the aforementioned circular, to ensure that assessments are carried out as appropriate.
I have a very brief supplementary, please.
Mr Speaker, in February this year, Minister, you said that single eligibility criteria, that single eligibility question would be implemented. Is it being implemented now? Because this is clearly one of the crises on our wards. People are backed up and aren't able to get home, even when the care assessment says that they should be.
And I thank the member. My department has set up a working group, and that involves the key stakeholders to develop guidance to underpin that new policy. and that will ensure there's clear information available on how the new single eligibility question will operate. That group's made up of representatives from the trusts, the Health and Social Care Board, Department of Health, and also stakeholder representation from AGNI. Work is progressing on the development of that guidance, with 2 meetings having taken place to date, and I expect that working group to report in the coming weeks.
That ends the period for a list of questions, and I call Tom Buchanan.
Thank you, Mr. Speaker. Minister, 2 weeks ago the report was published into the Mother and Baby Institutions, Modelling Laundries and Workhouses in Northern Ireland. It recommended the funding of comprehensive support services for victims and survivors for the duration of the investigation process and in the longer term. Can you then give us an update as to what funding will be made available to the victims and survivors services for the delivery of these services?
I thank the member for his point, and again, it was a very emotive, important piece of work that the executive took forward. I met the commissioning group who completed the report with the First and Deputy First Minister on the evening of its publication, and their very clear ask was that that work be prioritised. There's a report now from the working group, cross-departmental working group, to be brought to the executive as per the recommendations of next steps. I am aware one of the recommendations coming out from the working group was the TEO lead on this, such as the recognition that the women and the survivors of these homes deserve, but also the cross-cutting nature that it will see across all executive departments having a responsibility, and also, I think rightly so, the executive of Northern Ireland playing their part in acknowledging the hurt and pain that was caused to those women and their children.
Supplementary, Tom Buchanan.
Thank you, and I thank the Minister for his response. But Minister, can you give us any indication of a timeline as to when the monies will be available to deliver these services to these people?
And I thank the member for his report, or for his supplementary in regards to that. Again, the recommendation from the working group has to come to the executive. It's a TEO, Department of Health cross-department piece of work that has been taken forward. One of the recommendations from the working group was the TEO should lead on the implementation of actually acknowledging the victims and the women who were so badly treated, but also bringing forward the payments, as well as they have done in the historical institutional abuse system as well. So there is that continuity of understanding and of recognition that they are treated equitably and fairly, as has been done in other cases.
Dolores Kelly.
Thank you, Mr. Speaker. Could I have an update, Minister, on Bandside Medical Practice in Portadown?
And again, I thank the member, because I know this is something she has taken a keen interest in our constituency, and I recognise that this has been an unsettling time for patients of Bandview and has been particularly difficult during the wider uncertainty created by the pandemic. I would like to thank them for their patience and ongoing support for the practice and its staff as the Health and Social Care Board worked to secure a new contractor for the practice. I'm delighted that the Federation support units, acting on behalf of GP federations across Northern Ireland, took over the contract from the 1st of September 2020 and now provide general medical services to the patients that were of the former Bandview medical practice list. The practice is now known as Beechwood Family Practice. This is the first time in Northern Ireland that general medical services are being provided by GP federations. And in August, the Health and Social Care Board and the Federation support units wrote to the patients of the former Bandview medical practice to make them aware of those new arrangements. The practice has a new medical team in place and a new practice manager in post. The Health and Social Care Board is currently arranging to meet the Beechwood Family Practice to ensure that they have the appropriate ongoing support to ensure the success and ongoing delivery of that practice.
Supplementary, Dolores Kelly.
Thank you, Mr. Speaker, and I thank the Minister for his keen interest in this practice, because it has been on a matter of controversy for over 5 years, and under his tenure, at long last, we have got a solution. I'm not very optimistic in the answer to this question, but there's increasing accommodation needs in Portadown Health Centre in general, and obviously with the return and of hopefully face-to-face GP practice and multidisciplinary teams being rolled out, it'll be a greater problem. So I just wonder, is that at all on his plan over the next year or two?
I don't have the Capital Works budget plan with me, but I'll write to the member in regards to that. But it is also worth, and I think, repeating, Mr. Speaker, in regards to the new setup that Banview has actually seen with the GP Federation Support Unit actually coming forward and taking on this practice to make sure there is a continuity of support for the patients there as well. But in regards to the capital bill, I'll write to the member with that detail.
Call Diane Dodds.
Mr. Speaker, and thank you to the Health Minister for his answers. Mr. Speaker, people living with a tracheotomy can access public transport. They can travel on buses and trains across Northern Ireland. But I have a young constituent who has severe health and learning difficulties. And the Education Authority are using her trachea as an excuse not to transport her to school. Can you tell the House what advice the PHA has given to the Education Authority on this particular issue that allows them to discriminate against my young constituent and deny her an education?
I thank the member for raising what is a very sensitive issue with me today. I don't have the answer with me, as the member may be aware, because it is a very specific constituent matter. I will write to her or meet her in regards to this issue, in regards to what steps need to be taken to either come to a solution, an equitable solution, to ensure that her constituent is not discriminated against in regards to accessing either transport, should it be through the education system, or public transport as well. It's not an issue that has been raised with me before, but I thank the member for bringing it to my attention.
Thank you.
Ms. Dawes, supplementary.
Yes, thank you. Sorry, another COVID-related issue. As you imagine and as you know, there is a multiplicity of them in every constituency office. But I had occasion to attend a family funeral at the weekend, and the funeral undertaker in Lurgan approached me because he's very concerned at the massive mental health issues that are being built up in our community, because loved ones cannot attend and be at the bedside of those who are at end-of-life care. This varies across access and visiting varies across trusts and varies across trust residential and care facilities. Can the Minister tell the House what he is doing to bring some resolution to this particular issue? And allow families to have time with their loved ones in a very, very difficult and emotional time in their lives.
And again, I think the member, she will be aware that there is guidance that came from the Department to all trusts to make sure there was a standardised approach across all trusts. I'm aware that there has been some deviation from that, but I will advise the member that in regards to the publication that we put out as Visiting with Care, a pathway which was actually published on the 7th of May. It's available on the Department's website, and that pathway provides a staged approach to restrictions that apply to visiting in care homes and other facilities. I will inform the member and inform the House on receiving further advice around how residents with capacity may be facilitated and also supported in regards to visiting in other facilities. I have agreed, through recommendation and further advice from the Chief Nursing Officer, I have agreed to the implementation of the recommendation that we move to the next step in gradual easing, and that will take place from tomorrow, the 20th of October. And again, the pathway will be reviewed in mid-November, and our public health officials will further review the data and recommend further progress on the pathway if merited, and further the potential for additional easements over the 2021 festive period for visiting will also be considered.
Colin McGrath.
Mr. Speaker, we heard today harrowing news about the numbers of young people who are waiting for a first appointment with a consultant. Would the Minister agree with me that we are failing our children?
I'll agree with the member that we're failing most of society in Northern Ireland in regards to our waiting lists. Today's report by Nicky, which my officials have been engaged with in its publication and its production, was really about highlighting, and I think it does highlight, the challenges across the entirety of our health and social care system in regards to how we're letting down a large number of patients. I've said it before, from this place and in other places, that more needs to be done. We need more recurrent investment. We need support of our staff currently there. We're now paying the price of 10 years of underfunding as well. But I will, and I'll say to the member that in regards to the recommendations, we'll work with the Commissioner for Children and Young People in regards to the recommendations that she has made. But there's also a large amount of work that has already been undertaken through different avenues to address some of the needs that have already been highlighted in the Commissioner's report.
Supplementary, Colin McGrath.
Mr Speaker, the report and the media reports today have referred to 24 young people that have been waiting a year with a red flag diagnosis with cancer. That must be some of the most distressing time for parents, children and families. And would the Minister undertake that today, or at latest tomorrow, if there are children with a red flag case of suspected cancer, that they will see a specialist in the next 24 to 48 hours?
And I think the member have already asked all trusts to review those waiting times to make sure that there is an accuracy to what has been reported in the timeline of where the information may have been supplied to the Commissioner and where we currently are today, because current information coming from at least one of our trusts would show that there are no children waiting, and that's within the Belfast Trust area. But I want to seek that reassurance from across all our other trusts as well. What I will say to the member in regards to Children's Cancer Services specifically, the current cancer strategy, which is out for consultation, has a large section in regards to how we look after children with cancer in regards to the numbers that are present in Northern Ireland, but also teenage and young adults who are now transitioning from children's service into adult service and how they are also supported as well. So I would encourage the member, his party and all those who are concerned in regards to this, get involved in the consultation response to make sure that it is fit for purpose, that it meets the needs of all those across Northern Ireland. One of the first events I attended as Minister was actually one of the public consultations in regards to the development of the strategy before it went out for consultation. And what was very clear that day was the voice of young people, and they made it loud and clear that they felt their voice wasn't in the consultation, and that's why they are there now, because it is an important cohort that we have to support, not just those children who are going through treatment or have received a diagnosis, but also their parents and those who care for them as well.
Call Kelly Armstrong.
Thank you, Mr Speaker, for letting me in. Thank you, Minister. Minister, I recently met with Arts Community Network, who are delivering a programme on behalf of the PHA. The PHA's equality and monitoring forms took that group 37 hours to fill out online. I'm just wondering, is there a way that the Minister could review those monitoring forms to ensure that they're efficient?
I'll ask PHA to review those forms and how accessible they are, but I'm sure the member will also be aware some of those equality questioning forms are also crucial in regards to the monitoring and the work that we do, as well as a department, to make sure that we are meeting the obligations that are on us as well, and the PHA will be undertaking those same duty of care obligations as well. So I'm unaware of the specific forms that the member is referring to, but I'll ask PHA to have a look at them to see if there's any way they could be simplified as possible. I'll not give a commitment that they can be because of the information that they probably are collecting.
Supplementary, Kelly Armstrong.
I'll try to be very quick. The forms do ask for anecdotal evidence, and that's what's taken so long. But the problem with the forms also is when they asked people who are disabled who are attending the course for development how disabled they are, it's quite a negative way forward, and if we could review that to treat it more positively.
No, and I thank the member for that, because the multitude of forms that are out there, and the member's fully aware of that. Language is important, and especially when we're dealing with applications from groups who are applying to what are very challenging rules, challenging funding schemes, and if it is about equality questions, they should be appropriately phrased in regards to that. But I thank the member for again drawing that to my attention.
Members, time's up. Can members please take your ease for a moment or two?